listeners. You are now listening to Your Health Matters with Miss Dionne. I am the owner and founder of Missouri Home Health and Therapy. We have been providing extraordinary home care services in the comfort of your home since 2005. We provide skilled services, which includes nursing, physical therapy, occupational therapy, skilled therapy, and social work services. We also provide non medical services, which includes chore worker services. That's when an individual can come to your home and clean up your living area as well as fix your meals, and personal care hygiene services. So, if you are interested in any home care services or have questions regarding our Consumer Directed Services program, a program where you can get paid to take care of your loved one, please give us a call at 314 524 3958 or stop by our office at 11636 West Florissant Avenue in Florissant, Missouri. We look forward to serving you. Jubilee 690 AM listeners, once again, we have Laka Huyette, a registered dietitian, with us today to enlighten us on the good, the bad, and the ugly of cholesterol. Laka, how are you this evening?
I'm well.
That's
Thank you for having
good.
me.
That's good. I know you just came back from Paris. How was
Yes.
that trip?
It was amazing.
What was
I loved
different? What was different?
One of the things that I noticed in terms of nutrition, because of course I have my eye on that, is they have a lot of fresh markets, just whole markets where you have just all produce, and that'll be next to a store that has all fresh meats, locally sourced, next to just a whole store full of cheese, like different types of cheese. They really take pride in their food and the quality and the taste, and it's accessible in most of the neighborhoods, unlike here in the U.S.
Right, and we need that here. We need more fresh markets, more fresh food, so that we can, have a better choice in choosing what we eat.
I agree.
Laka, can you tell the listeners a little bit about yourself?
Sure. Yeah, I've been a dietitian for over a decade. I've worked in a variety of settings: hospitals, fitness centers, universities, military base. I received my training from Mizzou, and like I've said before, I have a real true passion for health, wellness, and nutrition that started at a very young age. And I truly believe in the beauty of living your life to its fullest potential, and I feel like nutrition is one of the pillars of that.
And I totally agree with that. Nutrition is what makes our life better, what makes us better as individuals. Today, listeners, we're talking about the good, the bad, and the ugly of cholesterol. Leka, can you give us your experience with dealing with individuals that may have high cholesterol problems?
Yes, I've had a lot of experience dealing with patients and clients who have problems with their cholesterol. Of course, I'm sure everybody knows someone who has cholesterol problems, and one thing I've noticed is you can really manipulate your lab results with nutrition. Just a few changes here and there, you can really make a big difference.
Right, listeners, I'm battling with cholesterol right now. I have high cholesterol. My doctor then told me that my cholesterol was high and my good cholesterol was high. So, Leka, can you answer a few questions for me to start off with? Let's see. If your doctor has told you that your bad cholesterol is high, what are some of the suggestions our listeners can take if their cholesterol is high?
One of the things you can start with is just cutting back on your fried foods and your processed foods like sausage, bacon, bologna. You want to cut those things out and instead incorporate some higher quality meats and higher quality foods, more baked fish and other meats that are not breaded or cooked previously. Just sticking to more with fresh or foods from frozen.
Okay. So can bacon be baked?
Bacon, yes, bacon can be baked, but you still want to minimize your amount of it.
Okay. So what else can we do if our doctor tells us that our bad cholesterol is high?
You want to also decrease the portion size of your meats to around the size of a deck of cards. And don't just save your meat for the end of the night. A lot of people, they really only eat their meat during the day because they skip breakfast, they skip lunch, and they only have their meat at night. So you want to make sure you spread that out throughout the day when you need the energy. And they've really shown that's one of the best strategies for weight loss, because having that protein throughout the day helps to manage our appetite.
Exactly. So eat that protein, eat that meat for your breakfast or your lunch, and do not save a heavy meal. And do not save a heavy meal for dinner, so that that's when you're getting ready to go to sleep, and your activity level is just lower at that time.
Right. You don't need it then.
Exactly. My doctor told me to eat meat that's the size of my palm. So about how many ounces is that for the size of your palm?
It's about 3 ounces. Is usually what they recommend. About 3 ounces.
Okay. So what is it if your good cholesterol, which is called your HDL, is low?
Okay, so if your good cholesterol is low, you can improve it with exercise. You can also improve it by switching out some of those less quality fats and eating more high quality fats like your olive oil, your avocado, walnuts, almonds. But any of that, you want to make sure you do it in moderation. We don't suggest eating a whole can of nuts, just a small handful.
Now, when I went to go see my doctor, I got my blood drawn, and my cholesterol, my bad cholesterol was high, but my good cholesterol was high as well. So is that a good thing?
Yes, that is very good. The HDL, the good cholesterol, its job is to go throughout the blood and basically capture the LDL, the bad cholesterol, and it takes it to the liver to be processed out of the body. So if your good cholesterol is high, then you really have more soldiers in there going to deal with the bad cholesterol.
And it's good to have those soldiers.
Yes.
So that we can stop that heart attack or that stroke. Okay. Can you explain a little about the triglycerides and what to do if your doctor says your levels are elevated?
Yes. So triglyceride is basically circulating fat in the blood. I always like to use this example of patients who have abnormally extremely high levels. Their blood can turn a whitish color because there's so much fat circulating in their blood from those crazy high triglycerides.
So white blood, but not white.
Not completely white, but not red.
So that's fatty blood.
That's fatty blood. Yes, and it does not move well. But so again, to help decrease that, you want to, if you are overweight, lose weight, because of course that's going to lower fat in your body. Cut back on your white starches like your breads, your pastas. Choose whole grains instead. I always like to give this example of a patient I had. She was doing everything right with her diet, except she was eating a lot of French bread with a bunch of jelly on it. And we cut that one thing out and dramatically improved her triglyceride levels. So cut back on those starches, those simple sugars, even juices, even fruit juices. Cut back on all of that. Sodas, jellies, sweets, things like that. And then keep in mind when you're taking those things out, you want to add fresh, good food back, your fruits and your vegetables.
Okay, listeners, I have something to confess. I'm a bread eater as well as butter. Now, I'm going to ask Laka about how does she feel about, I can't believe it's not butter, because I just switched from eating Land O'Lakes. I love Land O'Lakes butter to I can't believe it's not butter. And I can tell the difference. Okay. But what should I do? Can I go back to the butter?
So one of my biggest philosophies for nutrition is really to have the whole food as close to natural as possible. So, I'm a big fan of nature, and I feel like it really helps us. So my suggestion would be just to eat less butter. I have not really looked into I can't believe it's not butter lately, but my suggestion would be just have the real thing, but have less of it.
So I hear moderation.
Moderation.
That's the key thing. You listeners may be listening to this and trying to figure out, what can we eat? The key thing is that we can eat, but we just need to choose what we eat and eat it in moderation. Now we're going to talk about eggs for a little bit. Me and my husband was trying to figure out what we we're going to eat for breakfast, and we were going to make us some eggs. And I found out that one egg has 130 milligrams of cholesterol in it. So I was taught that you can only consume maybe about 250 milligrams to 300 milligrams of cholesterol. So what are your thoughts about the eggs?
It's really interesting that you asked that because the new dietary guidelines have come out recently. They come out every 5 years, and now they're saying we don't need to worry about eggs anymore. That the eggs, the cholesterol in your food does not affect the cholesterol in your body. So, and they got it wrong for so long, and everybody's just like, man, you can't believe anything you hear, because they were looking at these studies, just following people along, seeing what happened to them, but they weren't really doing any cause and effect studies. So that's how we got it wrong on the eggs. But eggs are okay. Dietary guidelines came out and they said there is no effect on eggs and the cholesterol that's actually in your body.
Wonderful. That is very interesting. So is cholesterol levels hereditary?
I would say yes and no. They can be, but what I see more often is we eat like our families did. How we eat as a child, that is our first nutrition class. So a lot of times what's happening is you're exercising the same way your parents did, you're eating the same way they did. So is it hereditary, or are you just really doing the same thing?
Okay, listeners, that kind of sums it up for this evening. So what I'm hearing from Laka is that we need to eat in moderation and we need to choose what we eat wisely. Laka, is there anything else that you want to share with us?
Yeah, I mean, I would suggest really, of course, eating more fruits and vegetables, and also more fish, having more fish in our diet. And if you don't like fish, talk to your doctor about fish oils and things like that.
Wonderful. So again, Laka Huyette, who's a registered dietitian, thank you for being on our show this evening, and I hope that all the listeners take all this information to change their lifestyle and choose healthy foods to eat. Thank you so much.
Thank you.